First things first, we have 2,469 cases of coronavirus in Victoria. That is 108 more than yesterday. The breakdown of those, and of course Annalise will be only too happy to take you through any further details that you might want, but at a top level, 14 are linked to controlled outbreaks, 25 are the result of routine testing, 69 of those cases are under investigation by our public health team. We have 509 active cases across Victoria. Yesterday, in what we believe is a record in single day testing, 25,553 Victorians were tested, taking our total tests to 906,574 since the beginning of the year. 25 Victorians are in hospital. That number is slightly up, but we have 3 people in intensive care and that number is down. Now, in terms of those numbers, what that essentially says to us is that we are doing more searching than we've ever done. That of course means that in accordance with the strategy you find more and more cases and you've got to then deal with the challenges that that throws up. Many thousands of close contacts, many thousands of Victorians who need to be monitored, who need to be supported in terms of quarantining at their homes. The challenge today is that we have got unacceptably high numbers in 2 further postcodes. And whilst it gives no one in the public health team nor the government any joy to have to announce that postcodes 3031 and 3051 will be the subject from 11:59 p.m. tonight of the stay-at-home order, where there is only those 4 permissible reasons to leave your home. Businesses in those affected suburbs and households will receive support in line with the other 10 postcodes, further to our announcement earlier in the week, and we'll provide any and all support that we can to those who are affected. Those entire postcodes are essentially added to the suburban lockdown from 11:59 p.m. tonight. Further, and this is in many respects the most challenging issue that we have dealt with throughout this entire global pandemic, 9 public housing towers in those postcodes will be the subject of a complete lockdown, effective immediately. Those residents, and I'll take you through the numbers in a moment, and Richard can give you a list of those 9 public housing towers. Given that there are positive cases in a number of those towers, and given the very high density of that nature of housing, the number of shared facilities, everything from laundries to obviously access and egress points, lifts, etc., the public health advice is to close those 9 towers. There will be no reason for any of those residents to leave their home for a period of at least 5 days, effective immediately. We don't take that step lightly. We know and understand that it is a big cohort. It is also a group of people, many of whom are amongst the most vulnerable in our Victorian community. But the risk to public health at a personal and family level, the health and wellbeing of those residents who all live very close to each other, the fact that there are positive cases in some of those towers and logical patterns of movement, friendship groups, family groups, mean that the best and most appropriate step is to the hard lockdown in those 9 towers. I again make the point that is effective immediately. Before I take you through the chain of command and the Victoria Police response to deliver that hard lockdown, let me just share with you some numbers as to those 9 towers. There are 1,345 units of housing within those 9 towers, and there are approximately 3,000 residents, that is adults as well as dependent children, that live in those 9 towers. So it is a very significant cohort, a very large group of people. The Minister will speak in more detail and give you the list, but we will provide any and all support to those impacted residents. There will be no one going in other than residents who are returning home, and no one will be allowed out of those public housing towers. There will be a massive logistical task to make sure that those people are fed, given the support that they need. I think we're equal to that task, and I don't for a moment underestimate how challenging, how traumatic in some respects that will be for those 3,000 residents. Richard can take you through some more detail in relation to the location of those towers and some of the support that we are looking to provide. Those matters are not quite settled yet. We'll have more to say about very targeted and specific support tomorrow. Can I inform you that there's been many conversations with Victoria Police today about how to give effect to these orders. I can indicate that out of the State Control Centre Commander, Victoria Police Commander Mick Herman, who many of you will remember the outstanding leadership he provided in the evacuation process. Many tens of thousands of people evacuated from their homes during this summer's bushfires. He will be in charge of the police operation. This will be at least 500 officers per shift. There will be a number of VicPol staff on each floor within these towers, and then a larger number of Victoria Police members will essentially police that hard lockdown at access points to these towers. There will be a cordoning off. There'll be some distance between where members of the general public can go and these towers. Can I just appeal to media and to everyone? There are many, many vulnerable people who live in these towers. Some of them will be returning home in the latter part of today, knowing that they will not be able to leave their home for a further 5 days, at least 5 days. I would ask that we all be as sensitive as we possibly can as to the privacy and the fragility that many of those people will be experiencing right now. This is a very significant step, not one that we've had to take before, but it is for the protection of those residents and the broader community that we take this very difficult step. The police presence and the police operation will be unprecedented, and Victoria Police are well placed to do that important work, particularly when you think about the amazing logistical effort that they put in during the bushfires earlier this year. Can I just say to all Victorians, these numbers are a very real concern to all of us. That's why it is so important that if you have symptoms, you come forward and get tested. If you are unwell, the only reason to leave your home is to get tested. If someone knocks on your door and asks for you to take a test, please be sure and answer yes. It is a massive contribution that you can make to the health and welfare of your family and every family. All the way along, we've said the data would drive us. There is some precautionary principle being applied in these additional lockdowns, but we have such numbers, we have evidence of sufficient cases to see the public health team advise me only a short while ago to take these steps. They're not taken lightly. We at no point underestimate how challenging this will be for families and businesses, particularly those families, many of whom are vulnerable in those public housing towers. But for their safety and the safety of all Victorians, this is the right approach. These are the steps that need to be taken. Can I just send a message again to everybody in those now 12 lockdown suburbs? You are on the front line of our fight against this virus. We are proud of you. We understand that you need support, and we will get that support to each and every one of you as best we possibly can. Your family's safety is important, and these measures are designed to deliver that. But your sacrifice and the contribution that you are making is central to the safety and well-being of every Victorian family. You have our gratitude. We are proud of the job you are doing, and we understand that there is a big need, a really big need, for us to continue supporting you, and we will. To the rest of Victoria, if you want to show your gratitude to all of those who are locked down and who are on the front line of this battle against coronavirus, please follow the rules. It's not that challenging. Keep your distance, wash your hands, cough into your elbow, and just use common sense. If you're sick, you can't go out, unless, of course, you're going out to get tested. If someone knocks on your door, because there is door knocking going on across the whole city, please be sure and consent to a test. Just before I throw to Richard to take you through some more detail of these public housing units, I just want to explain the order is made for 14 days. That's a function of the Act. It can be rescinded at any point. We will, the 9 towers that are being locked down will be locked down for at least 5 days, because that is deemed the appropriate period to test everybody, every single resident, other than those who've already tested positive, across those towers, and to have those tests processed by the labs. That data will then guide us as to what the next steps should be. But at this stage, it is at least that 5-day hard lockdown effective from right now. As to the sub-postcodes that have been added in, that will be consistent with the other 10 postcodes until the end of this month, and we will reassess at that point, or indeed sometime before then. I'll now ask Richard to speak to you about those individual housing estates, those public housing towers, and at least some early thoughts on the sort of support that we can provide them, those 3,000 people, and then we're happy to take any and all questions you have.
Thank you very much, Premier. And the 2 suburbs that the Premier has today announced, of course, are host to some of our biggest public housing estates, both in Flemington and in North Melbourne. And we know that those public housing towers, they're high-density towers, and as the Premier has indicated, we will be locking down 9 of those towers. But these are home to some of the most vulnerable people in our community, and we must respect that and honour that. And I know absolutely that we will do everything that we possibly can to support these people at this very difficult and challenging time. In that context, of course, we will have a bit more to say, particularly in the next couple of days, about potential for rent relief and indeed possible hardship payments. But we'll have more to say about that at a later point. But what I want to reassure all of our public housing tenants who are affected by this, that we will put in place all of the measures that will be required to support them in the most practical way, whether it's in relation to medical support, whether it's in relation to mental health support, drug and alcohol support, obviously the most basic things around food, and in that context, we believe that what we are going to be putting in place here is incredibly important, because we will always as a government stand by the most vulnerable in our community. And certainly many of those people, of course, are those who live in our public housing towers. I want to take you through where these towers that are going to lock down are. So as the Premier has indicated, there are 1,345 units and there are approximately 3,000 residents living in those units. And they are in the 2 suburbs. So in a suburb of 3031, which is Flemington, 12 Holland Court, 120 Racecourse Road, 126 Racecourse Road and 130 Racecourse Road are all subject to the lockdown. These are all high-rise towers. They are all, as the Premier has indicated, that they all are characterised by having common lifts, common entrances and common walkways within the flats themselves. So on the expert advice of the Chief Health Officer, and we believe that they present an acute challenge going forward. In relation to North Melbourne, there are the following sites will be subject to the lockdown: 12 Sutton Street, North Melbourne; 33 Alfred Street in North Melbourne; 76 Canning Street in North Melbourne; 159 Melrose Street in North Melbourne; and 9 Pampas Street in North Melbourne. Again, all of those are mid-rise or high-rise towers. We think that this is the appropriate action for the government to take in the context of ensuring that we address the obvious infections that are in both of those facilities at the moment. Both of those areas, but in fact that we protect our residents going forward. And I just want to reiterate the point that the Premier has made. People living in these public housing towers are some of the most vulnerable people in our community, that many of them are subject to comorbidities, and we want to ensure that we wrap around them all of the services that they are going to need, not just over the next 5 days or indeed potentially the next 14 days, but going forward, that we provide them with all of the support they need to maintain their tenancy, but obviously to maintain their wellness also. Thank you.
Happy to take any questions you have.
Premier, I guess the devil's advocate would say that is this going to be handled better than a hotel quarantine?
Well, I can indicate to you that Victoria Police are in charge of this important work. That's both from a public order point of view, but also maintaining the security of this lockdown. That is, I think, that is exactly the right way to go. And Victoria Police are, as we speak, in place to ensure that people are not entering other than those who are residents returning home, and that people are not leaving if they are resident in those towers. There is, under these lockdowns, unlike suburban stay-at-home orders that are currently operating, and where 2 postcodes will be added from 11:59 p.m. tonight, where there are 4 reasons to leave home. If you're in one of those towers that the Minister has just read out, then you will not be allowed to leave your unit, your dwelling within that tower for any reason. That is not an easy decision to make, but it is the appropriate decision to make. If I can draw an analogy, it is not dissimilar to the way aged care facilities are treated if there is a positive case, let alone an outbreak in an aged care facility. Such is the vulnerability and the susceptibility of many in that cohort, many residents in those towers, that to do anything else, as difficult, as unique as these steps are, unprecedented, would be to not follow the public health advice and would pose an unacceptable risk to the health and well-being of those who live in those towers, and indeed, by extension, the health and well-being of every single Victorian.
With us getting the second biggest day of cases and the biggest jump since March, how much responsibility do you need to take for that and how you've handled COVID?
I've spoken at length about the authority and the chain of command in our state. I don't think I need to add to that other than saying I'm the Premier of the state, I'm the leader of the government, and I'm accountable and responsible to get this job done. That's why I'm focused on that job, not focused, can I say, on things I can't change. We've got an inquiry into those matters. That's the appropriate way to go. That's at arm's length. What I need to be focused on now, and I am exclusively focused on, is dealing with this challenge and making sure we've got the right policy settings and that we are testing as many people as possible, providing support to those who need it, and trying to stabilise these numbers and drive them down. That is why I'm so grateful, noting that no team, even teams as big as the one we have assembled, many thousands of people, from door knockers to laboratory technicians to public health coronavirus detectives, there are many, many thousands of them, but none of us can do this on our own. We need those who are the subject to restrictions to follow the rules. We need all Victorians to follow the rules. We can't simply let our frustration get the better of us, and of course everybody is frustrated. Everyone would love this to be over. They desperately want this to be over. The fact is that we can't just go back to normal, where if you've got a sniffle, you just go about your business. This is wildly infectious, and all of us must accept the fact that we can't go back to normal. We've got to go back or find a COVID normal. That's what we have to do, and that's going to involve all of these basic common sense rules being followed by everybody. And I again make the point, I know and understand the level of frustration, the level of fatigue with this global pandemic, but we've got to stay the course. We've got to keep all of us playing our part. And for those who are not in lockdown suburbs, let's all of us show our gratitude. Let's all of us show our gratitude to those who are making a larger sacrifice because the virus is in their local community. And the best way we can thank them and show the fact that we are proud of the job they're doing on the front line of this virus is to follow the rules ourselves. That's what I'd ask of every single Victorian. The alternative is this gets right away from us, and we've got not just 12 postcodes locked down, but every postcode lockdown. I don't want to get to that point.
How likely do you think that would be?
I'm not about speculating when it comes to these things. The data will drive us. We'll have more to say. These additional postcodes that are added in tonight, with no joy, no sense of anything other than, you know, really clear appreciation that this will cause pain, but the pain it causes, the frustration or the difficulty that it causes, is nowhere near the difficulties that will be experienced if we have this get right away from us. We have seen across the week some stability in these numbers. The fact that our testing rates are going up and up and up and we are finding more cases is in fact a suppression strategy working. No one's pleased to be in this place, but unless you find cases, you can't wrap your arms around those positive cases, isolate them, quarantine them. You simply can't. It is always better to have the clearest of pictures, and that's why I'm so proud of all of those and grateful to all of those Victorians. I believe this is certainly a Victorian record, more than 25,500 tests in a single day, and we will continue to see that sort of testing rate, those sorts of testing numbers, provided of course Victorians across the board, regardless of their postcode or their circumstances, if you have symptoms, even mild symptoms, come forward and get tested, because that gives us the data, that gives us the most complete picture of where this virus is, and then it allows us to bring the fight to the virus. Much like a bushfire, and this is a public health bushfire, we need to contain it and then ultimately put it out. But if you can't find it, if you don't know where it is because people aren't getting tested, then that task just becomes much, much harder.
There was a testing site at the community centre right next to the Housing Commission flats, but no one turned up. So how does that illustrate the problem in this particular area?
I wouldn't make any comments about individual testing sites. What I would say to you though is we'll be going door to door as part of this lockdown. Every single resident will be tested, and I'd be confident that residents will agree to be tested, because if they don't, then of course the potential hard lockdown has to run longer, if not for the whole tower, but certainly for those residents who are not prepared to be tested. I don't see it that way though. I think people know and understand how challenging this is, how widely infectious it is, and we'll see widespread uptake of that testing, and that work has already started. There are a number of positive cases in a number of these towers. I'm very confident that there'll be a large public health team out there tomorrow going door to door, testing everybody across these 9 sites.
Do you know how many cases, can you give us a ballpark figure? How big is this cluster now?
I might let Annalise speak to this and put the epidemiological terms on it.
As of this morning, we had at least 23 cases linked to this cluster. I know that today we have linked at least another 3, if not 4 or 5 cases to this cluster across the 2 groups of housing estates.
At least 30.
So there was at least 23 at the start of today.
85,
I suspect it will be up to 30 by the end of the day. There's constant interviews and linking happening throughout the day. Yes.
Can I just ask the Premier?
Sure.
Royal Children's Hospital visitation, as you know, a lot of parents from the bush stay in North Melbourne, so how does that affect how they can see their children at the hospital?
I'm not entirely certain of arrangements that were put in place, but that is a very specific set of requirements for caregiving. And of course, caregiving is one of the permitted reasons to leave your home. The only people that would logically affect in a really binary sense, a complete yes-no sense, would of course be anybody who was from those 9 towers who were wanting to go and visit somebody at the Children's Hospital or go and visit somebody anywhere. They would not be able to do that. Now, we will make specific arrangements for anybody who needs medical care out of those public housing towers, whether it be physical health, mental health, food, supplies, all of those sorts of issues will be dealt with, and we're confident that we've got that work has already started, that the planning for that and the delivery of that has already started. We'll have more to say about that tomorrow by way of personal support, but the stay-at-home order for everybody in those 12 postcodes other than the 9 public housing towers does countenance people going to work if they can't work from home, providing care if they can't possibly get another arrangement put in place, being able to study where that can't be done from home, daily exercise. We're all well acquainted with those rules. So I think that would probably cover off the example you use. But just like any set of rules or any line on a map, there'll always be questions where we have to interpret things, we have to try and provide advice and guidance, and that's something that the public health team covers off.
Are these cases linked to hotel quarantine?
These cases are not the subject of any genomic sequencing. They're either the product of known outbreaks which are contained, or they're part of community transmission. And what I have just reported to you by way of numbers, there are just 69 of the 108 are under investigation today, and we will do that work day and night over the coming days, and some of those will be linked back to known outbreaks, some of those will be linked back to individual cases, and some of them we will never know what the source of that is. That's the nature of community transmission. The key point here is that we've taken the steps to try and limit the spread of the virus, to again drive some stability and declining case numbers. But again, we made the point a week or so ago now that because we were looking in such a targeted way, an unprecedented way, more testing than has ever been done, in a more concentrated way than has ever been done, we're doing that to find the cases. We know the virus is there. Our job is to find as many of those cases as possible. The fact that we have this much virus in the community is a concern. The fact that we're finding it, that is a good thing, because it means that we can then do the contact tracing, have people isolated at home, get people the care and support that they need, and further limit the transmission of this wildly infectious virus.
Do you feel like the government has lost control of the virus?
I wouldn't say that at all. There are teams of literally thousands of people, and I'll take you through the team. There's all of our emergency services, all of our health workers, the public health team, those people that are on the phones day and night, following up if you test positive, who have you been close to, who have you been with while you had symptoms. A literal force of people out door knocking, going door to door in those hotspot suburbs, not to mention all of our partners across the board providing welfare and comfort, all manner of support to people who are in their homes. And then, of course, many people that are sitting in laboratories, not just in Melbourne, but right across the country processing tests. As I said, 25,500 tests yesterday is, I think, a record, and we aim to keep those testing numbers up, and that's why it's so important. If people want to make a big contribution, in some ways the most important contribution to us putting this public health bushfire out, then come forward and get tested. It makes a massive difference, and it allows us to then contain the virus. That's why it's so, so critical, even if your symptoms are very mild. Beyond that, those in lockdown postcodes must follow the rules. All of us must follow the rules. And for those of us who are not living in a lockdown postcode, the best way we can thank those who are, the sacrifice they're making, the fact that they're on the front line, is to follow the rules ourselves and get tested, even if we have the mildest of symptoms. It's a simple message, but a very, very important one.
Just to confirm, did you say it would be 500 police per shift for
Correct.
the 9 towers?
Correct. That is the estimate at this stage. That may go up or down, but that's the estimate that the Chief Commissioner has provided to me.
And we're okay with having, like, in terms
Correct.
of numbers?
Correct. In the event, though, that either the public health team or the Chief Commissioner or anyone across the government's response requires further support of whatever nature, then of course we would process those requests in the normal way.
Is it inevitable now that all of Melbourne will be locked up?
I don't believe that's the case. I think that if people continue to follow the rules, I can't rule that out, but I'm not saying it. Your question was whether it's something that's simply going to happen. I don't think that's the case at all. I think that there are opportunities and a clear strategy and literally tens of thousands of hours work being done by a massive team of people, but not me, not any of those people, not anyone in the team, from the leader of the team all the way out. We can't do it on our own. We need people to take this seriously. We need people to do the right thing. I thank all of those who are. It's an enormous number of Victorians, but all it takes is one. All it potentially takes is one person doing the wrong thing, and this can get away from you. No one is pleased to be in this position, but my view And our policy is to acknowledge it, get on top of it, work really hard so that we can get beyond this challenge and again see stability, declining case numbers and the resumption of our cautious program to open up the economy and move to a new phase of this global pandemic. But if I can finish by making this point, it won't matter how quickly we can get to that point, the point of starting to open up again, the point of dealing with this most recent spike in cases, an unacceptably high number of cases, particularly those the origin of which is unknown to us, those community transmission cases. It won't matter how quickly that comes. At that point, we will not be returning to normal because there will be no vaccine in the weeks ahead, some argue even in the months ahead. It is a long way off. And unless and until that vaccine is developed and then administered to every single Victorian, we will have to live with and embrace a COVID normal, not business as usual, not a normal Victoria. That will only see us finish up with wave after wave after wave of unacceptably high case numbers and on and off restrictions for the foreseeable future. We don't want to get to that. So I thank all of those who are making a massive contribution, huge sacrifice. I'm very grateful and I'm very proud of you. To all of the rest of Victoria who aren't in a lockdown suburb, let's thank those people who are by doing the right thing. Let's look after each other. Let's make sure that every Victorian family is making a contribution to the safety of all Victorian families. It's not too much to ask. To put it another way, there are now 12 postcodes locked down. If we don't all work together and follow the rules, every postcode will be locked down. That is a very clear message. To those in the lockdown postcodes, we'll continue to support you. To those in those public housing towers, we will give you all the support you need. We will take care of you. Those communities are among some of the most vulnerable in our state, and that's exactly the response we'll provide, a targeted and unique response, an unprecedented response, and the Minister and I will be out tomorrow again to take you through some of the elements of that. In the meantime, if you're sick, get tested. If you're sick, don't go out for any other reason than to get tested. If you are the subject of a home isolation order, if you are a close contact of a positive case, or you have in fact had the virus, please follow the rules. Please follow the rules. We don't want to be fining people, but we will if we have to. That's how serious these issues are. We'll all get through this together. This is a very challenging day. These are very challenging times. But if we all look out for each other, if every Victorian family does the right thing, then we will safeguard the welfare of all Victorian families right across the state. If there are no other questions.
Sorry, can I just ask you, why was Andrew Cripp's request for ABA personnel cancelled?
In terms of these matters, Jennifer Coate, a former judge, is conducting an inquiry, and it's not my position to conduct that inquiry for her. She is exactly the right person to do this work. That work's already started, and she will be given all support to conduct a thorough inquiry at arm's length from the government and to give us the clarity that we need about exactly what has gone on across hotel quarantine. In the interim, I would just make the point, it's not about being critical for the question, it's perfectly fine, but I've got enough to focus on in the things I can change and the things I have to be responsible for right now. And that is my focus, and I'm unapologetic about focusing on the stuff that needs to be done right now and tomorrow and the next day and for the foreseeable future. Accountability is always with me. After all, I am the captain of the team. But let's be focused on what's most important, and that is right now and for the foreseeable future, containing these cases, slowing the spread of the virus, bringing consistency, driving down the numbers and resuming our process of cautious easing of the restrictions. That's what I am absolutely focused on.
Sorry, will the police be armed? I'm assuming they will if they're...
That's entirely a matter for Victoria Police.
Does the government consider relocating residents in the suburbs instead of...
The first thing to do is to limit the movement of these residents because, of course, if people are moving, then they are potentially carrying the virus with them. Beyond that, once we have all the test results back, which we believe is around a 5-day process, including the lab time, we'll be able to make further judgments about different groups within those towers, different policy and if you like, tailored responses, family by family, tower by tower. That's a few days away.
Will the testing be mandatory in the housing?
Well, there is no mandatory testing, and the mere notion of trying to hold someone down while you take a test would, of course, involve much more close personal contact than anything else, really. The important thing here is that if you were to refuse a test, then you would stay locked down in your unit, in your apartment, in your flat, and that would be, the length of that time would be something that I'd get advice from the public health team on. There's no reason not to be tested for your safety and the safety of all Victorians. People are going to be knocking at your door and they're going to be asking you to be tested, and the right thing to do for you and for all of us is to say yes.
Just one to Dr. Sorry.
You got one for me first, and then we'll do Annalise can finish it off.
Yeah, sure. Does the government feel bad about depriving thousands of people of their liberty?
Well, no government takes these sorts of decisions lightly. You base them on public health advice. You do what has to be done. And yeah, it's very challenging to have to make a decision like this, but when the advice is clear that this will contribute to slowing the spread, bringing some stability to our numbers and driving case numbers down, then there's no choice but to do this. Once you've made that decision, of course, then your energies focus exclusively to providing support and care to meet the personal, the material and practical needs of those 3,000 people. Everything from food through to medical support, both physical and mental.
I just wanted to...
Annalise.
Can you give us the total number of confirmed cases of community transmission as it stands now?
So, at the moment, we're up to 389 cases in total that have been as a result of community transmission with an unknown source, which is an increase of 26 since yesterday.
And has genetic sequencing shown that all coronavirus currently in Victoria stems from strains introduced since April, since early April?
So we don't have genetic sequencing on everything from the last couple of weeks. It's a long process. It takes at least a week, if not longer. The most recent sequencing that we have, as discussed by Brett and the Premier last week, does indicate that the strains in circulation at the moment are not the same as the strains that were circulating in March and April.
So from what we know already, do all the current active cases link back to quarantine hotels?
Look, at the moment, I'm not going to comment on quarantine matters for the moment. I can tell you what I've told you about the genomic sequencing, and obviously that will continue to be reviewed as sequences come in.
Some families that live in these community houses can number 8 or 9 people in quite cramped conditions. Obviously that presents significant risks for transmission of COVID. Can you talk about how the government's going to manage that?
Certainly. So we are, as the Premier said, we're not taking this at all lightly. We are extremely concerned that there are many hundreds of people in these towers who have already been exposed to the cases that we've found, and possibly to cases that exist and that we haven't found. So this is not just a matter of 23 to 30 odd people. This is a matter of many hundreds who've already been exposed and who may already be incubating. So agreed that close quarters living does make transmission more likely, but those people would have been living in close quarters regardless of whether they were in quarantine or not, and we will be working very closely with our housing colleagues, with a large number of other social services, to manage those risks as comprehensively as we can. If there are families that need alternative accommodation, that will be arranged. The first priority here is to find every case in those towers so that we don't have an explosion of infections in a highly vulnerable community and very high rates of hospitalisations and deaths because of the background health status of a large number of people in these towers.
Very good, Allgood. Thank you. Thanks very much.